All right. Well, welcome to our afternoon session on a health literacy approach to involve family and friends in diabetes prevention. We have a great group of people here this afternoon to talk to you about this work that we've been doing in Maryland. I'm Dr. Cynthia Bauer at the University of Maryland School of Public Health. I direct the Horowitz Center for Health Literacy, and we are one of the co-sponsors of this meeting. Am joined today by two longtime colleagues from FHI 360, a DC area-based consulting firm that does program work, communication, and lots of other great projects, Rebecca Letsky and Lisa Tenswan. Two other Maryland colleagues who have been very integral in the project that we're going to talk to you about today from county health departments. Danielle Stahl from the Washington County Health Department and Angela Deal from the Charles County Health Department. And then we have two participants, Judy and Mike Schroeder, who participated in the program that we're going to talk to you about today. And they're going to be sharing their perspective and experience. So I welcome all of our panelists, and we don't have too many slides. This is really more of a conversation, and we welcome your questions and comments. If you want to talk to each other, please use the chat function. If you want to offer questions or comments to the panelists, please use the Q&A. So Lisa and I will be monitoring the Q&A, and that's where we'll be looking for your questions. So without further ado, we will get started. So our learning objectives for today are to talk about the health literacy issues in standard diabetes prevention lifestyle change program, to describe two ways that we brought health literacy insights to these lifestyle change programs, and how a partner approach, which is what our project is called, can be applied to chronic disease prevention programs. Okay, so Lisa, I think you're going to take over from here.
I am. Thank you so much. So we're going to start today's session by sharing some information on the National Diabetes Prevention Program Lifestyle Change Program. And throughout our discussion today, you'll hear us refer to that as National DPP and LCP. So the Lifestyle Change Program is overseen by the Centers for Disease Control and Prevention, and it is a year-long structured program that's evidence-based. Participants join the sessions weekly for 6 months, and then they transition to monthly for the remaining time. The program is designed to prevent or delay the onset of type 2 diabetes in people with prediabetes or those individuals who are at risk. And throughout the program, participants learn strategies to make healthier food choices, decrease stress, and increase physical activity for lasting lifestyle changes. Next slide. So FHI 360, as Dr. Bauer said, we've been doing this work for a while now. We've been conducting formative research and communication work related to National DPP, and then Dr. Bauer and her team at the University of Maryland Horowitz Center has been gathering insights for National DPP participants and potential participants. So through these discussions between the FHI 360 and the Horowitz Center staff, came up with this idea that we wanted to pilot, asking participants joining the program to join with a partner. And this was an opportunity to use health literacy insights and for family members or close friends to enhance the program results. We thought that the partner approach might attract and retain more people at risk of diabetes, since recruitment and retention are both issues that programs struggle with. In addition, we felt that the partner idea might facilitate information sharing among family and friends that join together, as well as enhance those partners' health literacy. So Cynthia will talk just a few minutes now a bit more about the health literacy relevance before I dive a bit deeper into the project overview. Cynthia?
Sure. So one of the things that the FHI 360 team and I talked about when we were thinking about this partner approach was a lot of times programs are very information intensive, right? They might be focused on behavior change, but to get to the behavior change, there's a lot of information and materials that go along with that. And in the National Diabetes Prevention Program in particular, there's a lot of materials that the coaches give out that the participants work with over this 12-month period. there's a lot of information sharing. And we said, well, that's kind of the obvious piece of that, right? We can bring health literacy insights to improving all those materials. But what about the program itself, right? If what we're trying to do is build health literacy, not just at the individual level, but at the community level, we've got to start impacting more people, right? We've got to broaden the reach of this program. We have to start building people's understanding of why diabetes is such a, prominent public health issue. Here in Maryland, this was all part of the work we were doing with the State Department of Health, because they had put out a state diabetes action plan. And that action plan, many of the strategies were focused on trying to bring more people into these lifestyle change programs. And so there was certainly a promotional kind of awareness building aspect to this as well that FHI 360 has a lot of experience with it. So they've done projects trying to do, population-based promotion of these programs to make them attractive to people to even sign up for. So we felt like there were just a lot of different aspects to health literacy and health literacy insights that could really be brought to bear on these programs in particular, but with the overall health outcome of trying to engage more people in diabetes prevention and ultimately, change the very dire projections of how many people are at risk of developing diabetes, right? So the numbers are really staggering if you look at the at-risk, the people who are at risk of developing diabetes. So we just felt like this was just one step forward in trying to broaden this beyond an individual lifestyle change program. Anything else that Lisa or Rebecca wants to add to that?
Nope, not for here, thanks.
No, thank you.
Okay, great.
All right, so we went ahead and we did develop the partner approach concept to explore program acceptability, engagement, and the outcomes. So we worked with 6 national DPP, LCP provider organizations in Maryland, and we asked them to recruit and enroll partners into the program. The person at risk for diabetes was to ask a family member or a friend to join them in the program. So at least one of those partners had to be program eligible. The sites conducted the LCPs online, in person, and then also through distance learning. And our team developed the tools for recruitment and implementation. And we also evaluated the approach and the materials, which Rebecca is going to go ahead and talk about now. Rebecca?
Hi, thanks. I'd love to start by saying that, as Cynthia said, we wanted to learn not only whether organizations would be able to get pairs to join, but we also wanted to know whether or not this would hopefully happen at levels that they had been joining before. And we wanted to know whether or not participants who joined with a partner were more likely to complete the program. Like all health education programs, dropout is a major problem with the national DPP. So the good news, as you can see on this slide, or the good news is that organizations were able to enroll the same number of participants as usual in lifestyle change programs. There was one of the 6 sites that was an exception, but they frankly chalked up their inability to recruit to COVID-19, which was happening while we were looking at this, rather than the fact that people joined as partners. So as I said, one thing was a check. Sites were able to enroll people in partners just as they had been able to before. We also, though, found that across the 6 sites, participants stayed in the program at levels that were higher than typical. Across almost 3/4 of the participants overall completed this 1-year program. And if you thought about, as Lisa said, some of the participants were eligible for the program. If you thought only about those people who were eligible, people who were at actual risk for developing type 2 diabetes, that was 80% of people who joined completed a 1-year health education program. An analysis of CDC data that's been published showed that across all the programs that have been implemented and were captured in this large data review, the typical 44-week completion rate for national DPP was about 32% of initial enrollees. So, you know, this 3/4 to 80% versus 32% is what we're talking about in terms of completion. It was important for us to find out whether or not also, if you joined with a partner, whether or not you finished with a partner. And we found that close to 60% of pairs finished together. So if you consider that 32% of people, if they join alone, complete, it's absolutely true that pairs were more likely to finish this LCP than participants in programs where they joined alone. If I could go to the next slide, I'd like to talk just a little bit about the results from the point of view of participants. Participants, as we indicate here, really liked this program. They enjoyed working with a partner. Some participants, as we indicate, said that they actually joined this LCP because they could join with somebody else rather than doing this as an individual. Many of these people who said that had frankly tried other individual behavior change programs around physical activity, weight loss, or healthy eating. And even if they had had temporary success, had not managed to sustain it. So they were eagerly, if not looking for, eagerly grasped a program that allowed them to join with somebody else. Participants mentioned that they had recognized from the onset that joining with a partner would set up a good dynamic in which they and their partner could make healthy lifestyle changes and hopefully manage to sustain them. People who joined found the program to be enjoyable and helped them build connections to their partners. It also helped them build connections to others in the group that they joined with. And participants not only learned how to work with someone else around issues such as healthier eating or increasing physical activity or finding ways to deal with stress in a fashion other than a pint of Haagen-Dazs, but they also found that they felt accountable to their partner, not only for working towards a healthier lifestyle and helping their partner work towards a healthier lifestyle, but also to consider weight loss. And they also felt accountable to their partner to stay in the program. And both partners tended to indicate that they had this mutual and shared accountability. Partners also indicated that after the program, they felt accountable to their partner and it intended to continue working with them around healthy eating and physical activity. Partners discussed additionally that having a partner helped them get through moments of weakness or resistance. And that happened to everyone in these year-long programs. Frequently, one partner would go through it and then another partner would go through it at a different time. So that wasn't shared experience necessarily in terms of time, but it is something that each partner was able to help the other through. At the end of this 12-month period, the people who finished, which as we discussed was most of them, were very enthusiastic about the program still. Some participants had already begun referring friends to the program. And additionally, participants said that they would help the programs to recruit for the LCP, and that they'd be more than happy to come to classes to share insights or offer themselves up as a positive case example. Cynthia had mentioned the information that's passed through this program. And one of the things that we did find was participants wanted information about diabetes and how to prevent it and how to be more physically active and more successful with regards to healthy eating. But they also wanted more initial information about how to select a partner. And then once a partner was selected, how to work successfully together around maintaining a healthy lifestyle once the lifestyle change program was in session and once it was over. Cynthia, if you could switch the slide. One of the very gratifying things was that lifestyle coaches really liked the partner approach as they implemented it. They saw it as providing, based on our interviews with them, a level of support coupled with accountability that was not present necessarily in lifestyle change programs when people join alone. In those instances, people look for support from the group rather than from somebody they have more access to. Lifestyle change coaches tended to share that there was less attrition and even somewhat more success among partnered participants. And it was also commented on that participants seemed to the lifestyle change coaches to be more engaged and participatory in shared sessions than people who joined individually. Additionally, it was mentioned that people seemed more comfortable from the onset and didn't have to get used to talking in a group environment because they already knew somebody there, their partner. Happily, lifestyle coaches all across all 6 sites all expressed that they would like to facilitate more partner approach lifestyle change programs in the future, with some saying that they'd like to do at least one a year, and a pair of our lifestyle coaches indicating this, if it was possible, they would like to actually mostly or solely do partner approach lifestyle change programs because they felt that the level of support in joining with a partner is really what was needed to be successful. If we can move to the last slide in this section. Our conclusion then is, as stated, that the partner approach lifestyle change programs are not only feasible, as we showed in the beginning, but attractive to both participants and lifestyle coaches. We believe that our data at least show that implementing partner approach lifestyle change programs may lead to higher levels of completion, and hopefully in the longer run might even help to enroll more people in the program. And additionally, we hope that people might actually basically that people might be more successful and that participants would actually get the support that they need. One of the things that we think is striking is that in the partner approach, only one person typically made the initial decision to join the program, and then they went looking for a partner and joined together. We believe that this actually indicates that you may be able to, as we said, enroll more people in lifestyle change programs using this approach than you would otherwise, because you might have 1/2 of the partnership being an individual who wouldn't necessarily seek to join a program. And for that reason, this might help have the national DPP LCPs have a population level impact that it was intended to have, and that is lead to sort of population level type 2 diabetes reduction. And at this point, I'd like to turn this over to Lisa.
Yeah, thank you so much, Rebecca. So I'm actually going to ask Angela and Danielle and the Schroeders to join me on camera.
And Lisa, you want me to stop share?
Yeah, stop share, please, and we can have us all on the screen. That'll be great.
Okay.
Excellent. All right. Hold on, I'm just making sure I can see everyone. I can see everyone. Okay, so we're going to spend a couple of minutes now. We're very excited about this part of our discussion today. We're going to talk with Angela and Danielle and Mike and Judy about their experiences in the partner program. So I'm going to ask each of them to just start by introducing themselves and tell us what your role in the partner approach program was. And we'll go ahead and start with Angela and then move to Danielle and then to Mike and Judy.
Sure. My name is Angela Deal. I work at the Charles County Department of Health, and I was the lifestyle coach for this partner approach project.
Thanks, Angela.
Hi, I'm Danielle Stahl, and I'm with the Washington County Health Department, and I was also a lifestyle coach for this approach.
Thank you, Danielle.
And I'm Mike Schroeder. I'm the one with the prediabetes.
Okay.
And I have had it for a long time, and that's it.
Perfect. Thanks, Mike.
And I'm the partner of Mike. So, and Angela was our coach.
Yeah.
Great. Well, we are so glad that you're all joining us today. So, Mike and Judy, I'm going to start with you. Can you talk a little bit about why you joined the program? Why did you join the program with Angela?
Well, partially for me personally, it's been in my father's side of the family, diabetes, and I didn't want to get into that thing. Now, my father never had diabetes, but 3 of his brothers and his mother all had it, and they were all very big people. They were all like in the 300-pound range or more. So and it was just something that I didn't want to fall into at all.
Yeah. Okay. And Judy, you joined because you wanted. Why did you join the program?
Well, Mike had always expressed the desire to do something that was maybe longer term than just your doctor sending you how to eat when you get your blood work, something that was a little bit longer term, sort of an approach to maybe controlling or a little bit of education about what to eat, what not to eat, and exercise and that kind of thing. And this seemed, as a year-long program, it seemed like it really sort of fit the bill for what he was sort of looking for.
So now that you've gone through the program, Mike, what did you like about it?
Well, I just liked the participation with the other people, and got to find out how they approached it. And for me personally, and I've told this to Angela plenty of times, the MyFitnessPal was the greatest thing in the world. I'm still doing it. I'm going on to 500 days in a row now of checking in all my meals every day.
That's great. Congratulations.
Thank you.
And Judy, what would you say you liked about the program?
Well, I think it was overall very interesting. I mean, it helped me too to pay more attention to what I was eating and pay attention to portion sizes and just overall pay attention more than I think I was doing.
Okay.
And we were able to help each other, and that's a good thing. The little reminders and instead of directives, more like reminders.
Yeah, that's great. And that was my next question for you. So how did joining this program together help you work towards your healthy lifestyle goals for each of you?
I would say that, as Judy just said, the paying more attention, looking at the labels of the foods that you eat. When I go to a store and get certain items, I'll always used to get a snack and a soda, and I haven't done that in years. I get an unsweetened iced tea or water, and I don't get any snacks at all.
Mm-hmm. Mm-hmm.
So, and and it just made me think about it. And being with her, doing certain things, it just makes it so much easier. Because you pay attention to what you're doing.
Mm-hmm.
And I think the partner part was really, really, really good.
It's helpful.
Yeah, it made it very, very easy,
Mm-hmm.
especially when you think alike, because we do think a lot alike.
That's great, Mike. And that's a good perspective as somebody that was at risk for type 2 diabetes. So thank you. Judy, did you have anything else you want to add to that as kind of his support as the partner that went into this to support him?
I like the idea that we were doing it together. It wasn't something where he would go and then come home and tell me what he learned,
Mm-hmm.
because we're experiencing it together. And sometimes one of us would remember something that the other one didn't about what was presented, and we could help each other that way.
Excellent. Thank you for that. So Angela and Danielle, I have a question, then I'll let Cynthia jump in here. So can you tell us why you were interested in participating in this program? And Angela, I'll just start with you because you're at the top of my screen, so I'm working down.
Sure. So I was very interested because I had seen other partners come through classes, and I just thought that maybe they were a little more successful, that they had a support person, like Rebecca said earlier, that they had more access to. I think that was key. So that's really why I started. I just wanted to see if a whole class would make a difference.
Mm-hmm.
Of
Okay.
partners.
Yeah, and I would go right off of that. I have been teaching DPP, and I've seen people come in who were good friends, coworkers, and you see, that strong bond right in the beginning and that support. And like Angela said, it really intrigued me to be able to actually teach a whole class where everyone was paired up to that and kind of really came in kind of having a strong support system, instead of going into week 8 where then we're starting to talk about support buddies. Right. This was kind of the foundation for it.
Great. Thank you, guys. So Cynthia and Rebecca, I'll look to you to see if you have any questions you want to jump in on before we talk a little bit about some of the outreach strategies and materials and things like that.
I actually have a question for Mike. Mike, would you have joined if you couldn't have joined with Judy? Like if it had just been an individual program, would you have joined on your own?
I'm not sure that I would have, to be honest with you, but it would just depend on how it was presented. If it was singly, but it was much easier with with the two of us together.
Okay, yeah, because when Lisa and Rebecca and I first talked about it, I had seen a documentary many years ago. It was about helping children, who were overweight. And the documentary featured the parents talking about, their families and how trying to help their child was changing things in their family. And I was just really struck by the responsibility that fell on the mother to, the mothers and the families primarily to help their children. And I kind of was thinking about that when we were talking about the pairs, because I thought we had been hearing in some focus groups that if like a couple like you, if one person's in a program and one person's not, what happens with that other person, especially if that other person is often involved in the shopping and the cooking. So did you, did you see that really made a difference, that you guys were not just talking about this, but doing these things together, like the shopping and the cooking and whatnot?
Yeah, for me personally, because she does most of the cooking, but there's a lot of things that I do that she doesn't do. Because I fix stuff like paella, which is not the greatest as far as because of the rice.
Mhm.
But you know, there's a lot of things that I cook, so you know,
Mhm.
I think it's just overall, it's made us better. It's better food choices and better dieters than we ever were before. And I'm planning on not ever going back to the way I was before.
Judy, do you think it would have been hard to make all the changes just for Mike and not for yourself?
I can't say that that's true. I've always been interested in healthy eating. Heart disease runs in my family, so we know about healthy eating. But having those reminders for a whole year, including diabetes and all of that, prevention information was very helpful.
Okay. Rebecca, did you?
No, I'm just fascinated.
Sorry, Angela. It looked like Angela wanted to jump in there.
Oh, no, I just had one thing to add that I discovered is, a lot of couples really enjoy spending time together. And a lot of couples, they only have the evening. So to sign up for a class for a full year that you're going to be gone for an hour to 2 hours, depending on travel time, a lot of people just won't do it. So if they're allowed to join together, it really makes them more likely to sign up.
Well, and let's talk about that for a little bit, Angela. So we talked a little bit earlier today about, recruitment can be an issue. Certainly retention is a problem. It's challenging. So when working with the partner approach, what strategies worked best for you, Angela or Danielle, when reaching out to participants about the partner approach?
So I really did the same kind of marketing strategies that I do for a regular diabetes prevention program, which is I send postcards out to people's homes. And the messaging was a little different about joining with a partner and making sure you had a support person. And then I did some social media posts targeting partners specifically. But I really just made sure to call everybody and kind of talk to them about what partner they were choosing. Because I just thought if we found the wrong partners, it might not work as well. So we just had to spend a little bit of time on the front end to make sure that they are selecting the most supportive partner that they could.
Great. And Danielle, what about you?
Yeah, I would say pretty much recruitment we did about the same we would do for our other class, just really honing on in that kind of language of, this is partner, this is do it together. And, you don't necessarily have to be at risk to be a partner. You could just be someone who really wants to be supportive and go through the program. Mm-hmm. And like Angela said, yeah, there was that kind of upfront extra time of doing kind of almost like a little interview process with them of trying to get to know them a little bit better to determine, is your sister who lives in Florida really going to be the person who's going to support you best? Mm-hmm. Let's look at maybe some alternatives, maybe people who are around you more, or, or looking more in that relationship. She lives in Florida, but maybe you guys talk every day. Mm-hmm. So it's really exploring those details of the partnership. And I will say, my program was built of sisters, mothers, daughters, husband and wife. So there was a very wide range. But I think they all worked in their own way. It's just like Angela said, it's making sure they have the right partner.
Mm-hmm. Mm-hmm.
So Lisa, we got a couple of questions about that. So overall, so Danielle, you spoke to that. Angela, you might want to address this, but the question was, were most partners spouses or family members who lived together?
I also had a wide range. I had friends, a couple of friend groups, mostly spouses in my group. And then I did have a mother and a daughter. And I did have friends that didn't live together also, which was an interesting dynamic. And just like Danielle said, they all worked well in their own way. They made it work.
And then you guys were both virtual programs, right?
No,
yes.
Mine was
Oh, you were in person. Okay.
Yep. And I was virtual.
Okay. Okay.
Yeah, and there's a question in here as well for Mike. Mike, the question is, did you move out of the pre-diabetes status?
No, I have not.
Okay.
That's the funny part. I don't understand it. So there's something that I'm doing that's keeping me at 6.0. All of my numbers, like my cholesterol. I mean, the good and the bad cholesterol are both in the 50s. The triglycerides are in the 70s or below, and all my numbers are exactly in the middle on everything, except for the A1C. It's staying right at 6.0, and I don't know, because we have a friend who is a vegetarian completely, and her cholesterol is through the roof, and they can't figure out why. And I think it's all genetics.
Yeah.
And the one thing that I'd like to add that I didn't think to say on the partner thing, or the doing it by myself, I think that the only way that really works is if your partner is willing to do the help. And because so many people that do a single program, like a wife or a husband, and if they don't have the support at home that the partner comes in, then they're doing their thing. They're not going to support you as far as what you eat. They're going to fix whatever they fix.
Mm-hmm. Mm-hmm.
So I think the partner thing is so much better.
Because you have that support. You have the
Because
same goals, you know
exactly
what you're doing.
We're all
Yeah.
And that's actually a question is tips from any of you about selecting a supportive partner. So Mike, you said somebody who's really aligned with the same things you are. Do you or Judy have any other tips for picking a supportive partner?
Well, the question would be, are both people willing to change what they eat, to change how they think about food, to change how they think about exercise, to change how they think about being healthy? And if you have someone who's not willing or is in total denial about any of those things, they wouldn't make a good partner.
Mm-hmm.
Okay.
Mm-hmm. Those are good points.
Angela or Danielle, do you have any tips on supportive partners?
I think Judy hit that right on the head there. Just making sure you kind of have the same goals and, want to support each other both in that way. A little healthy competition is okay, but if you're so competitive that you're battling over your goals, that's really not helpful.
There's one question that somebody put in chat. So it's about the DPP being offered in Spanish, and if yes, what's the retention rate? So none of the 6 sites we had did a Spanish version, but I believe it is in Spanish, right?
It is in Spanish. There is a tested curriculum that CDC makes available to lifestyle change programs that is in Spanish, and it's offered in Spanish, both online and in person across the country.
Do you happen to know what their retention rate is?
I do not know what the retention rate for Spanish language versions are.
Okay. All right. That's all the questions I see in the chat. Cynthia, you as well? Okay.
Yep.
So maybe we can talk a little bit. Should we dive a little bit into the communication between the pairs? Okay.
Yeah. So I guess we'll start with Mike and Judy. Do you think, or I guess, how do you think being part of this program changed your communication as a couple?
I would say it took away the sort of adversarial aspect about food. I was usually the reminder of, well, don't you think you should eat fill in the blank? That never went over that got to not going over very well. So for Mike to have gone through this, he takes more responsibility about his food choices. And so I don't have to be the reminder.
Yeah, I don't miss pizza. I don't miss getting like greasy hamburgers all the time and all that kind of stuff.
Well, we weren't eating that much anyway.
No, not that much anyway, but
still,
yeah, it's the same thing. French fries, all that kind of stuff. I will eat them occasionally, but it's very, very few and far between when I do.
Okay. Well, that's a really interesting observation, I think, because that's not typically a selling point, right? That's or a potential reason that these programs might be helpful to what Judy was saying, is that there can be sort of both implicit and explicit tension created by these behavior change programs, right? Because you're asking people to do not just minor things, but pretty major things pretty differently.
But actually the tension was before we started the program.
Right.
There was no, there was no program.
Right. Yeah. So Angela, Danielle, did you observe anything that, change over time in the communication between the pairs? Did you either in talking to the pairs or just observe anything in the class dynamic?
For me, I saw a lot more communication as far as let's go shopping together. Let's try a new recipe together. Let's spend some time in the kitchen cooking together. Whereas some of these pairs, I don't think ever did that. There was one person that did the cooking, one person that or they both ate the food. But now it seemed to be more of a partnership just in their households, I felt like. I don't know that was, obviously that wasn't the goal of the program, but it definitely helped with their communication with each other, I think.
Wow,
Yeah,
maybe we found a secret to equalizing household responsibilities.
Yeah, to have another example, I had a mother and a daughter who lived like very close, like could walk to each other's houses essentially. And through the program, they were saying, through communication of just reaching out to say like, I'm so stressed, I don't know what to do. Like they would come together and they would try to be like, okay, well, my family's going to make the meal tonight and your family just come over, or vice versa. Or if it wasn't time, they'd be like, I'm going to make this big meal. We'll split it in half. I'll drop it off at your house. So I found this communication where it was just that support too, of just things that they were already mother and daughter before they joined the class, but through the program, they started to really talk more about like their emotions and how that tied into things and stress and how to really work on that together and how to really come together to help with food, walking. They would start meeting at 6 a.m. and go for their walks. So they really were able to even build a better and stronger bond between each other.
Yeah. Great. Anything else people want to add about the communication with the partners? What about with the coaches, right? Because, the program, the quote, traditional or standard program is structured that the individual participants kind of start, probably communicate most with the coach, but then as you said, by week 8 or so, they might be communicating more with each other in the program. But anything from a coach's perspective, do you think changed about that communication for you?
For me, I tried to really still communicate with people individually because I knew not all of the pairs were the greatest supporter. Most of them were, but there were a couple who were just like, I don't know if you did the best job here picking your partner. But so making sure that I took that time to communicate separately also was important because they weren't necessarily going to share information that I said to one person over the other. So just making sure to treat them individually also, I think, was important.
Yeah, I would absolutely agree with that too. One thing I do with my participants that might be a little bit different is we have our weekly meetings and blah, 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 but I would always try to schedule at least 2 one-on-one meetings where I left it up to the participant to kind of tell me how they've been feeling, what they need, and go over, in more detail, because they might not always be comfortable sharing things with their partner. And I felt, hey, you can come to me as a coach, after this program, you won't probably see me again. So if you want to share something more personal that you don't feel comfortable sharing with your partner quite yet, I felt like that was an important, as a lifestyle coach, to be able to treat them and say, like, you don't have to share everything with your partner. I'm here as a trained lifestyle coach that I can also help you through things. So I think that was important in communication. And I will say, like, just from the get-go, the communication just from the whole group, I felt was more open, more honest, and I felt more like a facilitator than I did having to lead the class. Whereas at the same time, I was actually teaching another class that was just single participants, and I could see the huge difference in them, and because they were only, I think, 5 weeks apart from start dates. So I could really see the difference in them. And there was a couple, like in my individuals, where it was like pulling teeth to get them to talk to each other and share. Whereas I just felt with the partners, they already kind of came in with a little bit of comfort, knowing that, hey, I have this other person here, and I felt like the conversations just flowed much more freely.
I agree.
Did you guys ever have to mediate? I know that did the partners that did not work so well, did it just mean that one partner kind of dropped away?
Without sharing too much,
yeah.
So I had a pair that just, they probably shouldn't have joined together. I don't know that they were really working on goals together. They had kind of an adversarial relationship. And that was a little tough. They didn't necessarily bring it up a lot in class, but you could just feel it. Okay. So no mediation was necessary. They kept themselves in check.
Did they finish the program, Angela?
They did.
Okay.
Yeah.
Okay.
Yeah. Well, maybe, we hadn't really talked about this as, there's always unintended consequences of any program or intervention that you do, but maybe, whereas, so Judy, somebody commented in the chat that they really liked your observation about not having to be a reminder, and thanking you for sharing that. An unintended consequence could be also maybe surfacing some tensions, right? That maybe people hadn't been dealing with before. So that's why I was kind of wondering if maybe as coaches, you got a little bit in the middle of something for some of your pairs.
The only thing that I can think, and this is so minor, is there was a couple that were kind of competing a little bit too much. And they would come in and they're like, oh, well, I did, and this was a good one. I did 150 minutes. I did 320, and that was good. But then they would start doing, well, I lost more weight than you did. And I was like, well, let's remember that's not all about weight loss. We're making lifestyle changes one little step at a time. So that was really the only thing. And it wasn't major, but I could see how it could be problematic if you had some stronger personalities that had those feelings.
Yeah.
More competitive people, huh?
Well, and that was probably for Rebecca and Lisa, you can chime in on this. That was probably one of our biggest recommendations in the report on this project, is that the partner selection is really like a central issue if you're going to run something like this, right? Because it's not just it is the pair themselves, but then it's the dynamic, because you're in a group, right? You're running a group and you're trying to facilitate, 5 or 6 or 7 groups, pairs of people as part of a group dynamic. And so there's just a lot of that, communication group dynamic that you have to be mindful of.
Yeah. There's a question that did come in, and the question is, what platform allowed all partner pairs in the program to communicate with each other? So I think that can be for all of you. And then the second part of that question is, was it in the virtual meetings and outside the meeting? So I guess how you did interact on that platform. So Angela and Danielle, we'll start with you. Any thoughts? Did you guys use any platforms for people to communicate?
So I used mine through Halt Diabetes. So that is an online program where they have a video that they watch each week. I send daily messages through the platform, and then we have a community board on the platform that every Wednesdays I would pose like a community question, or sometimes I would just kind of leave it fun, like, hey, what recipes did you guys try this week? So that way they had an outlet outside of like, because then we would also meet for 30 minutes once a meet using Google Meets video. So we really tried to use a variety of different forms, that you had your weekly kind of face-to-face virtual meeting with everybody. But then we also had our message board that I really tried to encourage them that, like, hey guys, if want to take a picture of a meal you made and put it on the message board with the recipe, please do that. Do that anytime. Like, you don't have to wait till our face-to-face meetings to connect with each other. So I will say it took them a little bit to start using that feature. But I found that it was really helpful that, people would share little different things here and there, and it kind of helped keep them connected, since they didn't see each other for a whole week, and then eventually every 2 weeks and once a month.
Great, thank you. Angela, did you use any platforms?
So my class was in person, so the only time they had to engage with each other was in person. And I don't believe this group shared telephone numbers or anything like that.
No.
No. And sometimes they'll meet and do some walks because we're right beside a trail, but I don't know if you guys did that. It was still a little COVID heavy then, so we didn't do as much interactive things as I would have liked, but.
We do know that some of the other groups use WebEx and Zoom as their meeting platforms.
Great, thanks, Rebecca.
I was
going
to say, maybe Mike or Judy, do you have any comments on how you would like, as participants, like how would you like additional support? So like if you were talking to coaches who are thinking about doing this again, would you want additional communication options, or since you were doing the program in person, was that enough for you?
I would say it was probably enough. We always knew we could contact Angela, by phone or email with questions, or with if we came upon a recipe that that was interesting, that we thought the group might like, sharing that recipe with Angela, and then she would share it with the group. So it was I never felt unsupported, as we went through.
And I think that's important to call out, is that you could reach her by phone or email, right? Yeah. So those are additional communication options for you as participants.
Yeah, I think it was better to be in person, because that way we got to know the other people that were in the group. It was much easier than it would have been in a group. I mean,
on Zoom,
on Zoom,
on totally Zoom, or
whatever platform.
Yeah, any sort of virtual.
Right.
Yeah, to me, that was a whole lot better.
So we have what could potentially be an interesting and maybe controversial question here about the 12-month time frame, right? So that's set, that's part of the program, or this particular program. So if you're doing the National Diabetes Prevention Program, Lifestyle Change Program, as certified by CDC, that is what the program is. But would you all like to comment on 12 months and sort of what your view, I know you guys are certified coaches and you use that program, but just any thoughts about, how does time affect this? Mike and Judy, how did it feel? You said a little bit about, a longer program helping you with the change, but just comment on this 12-month time frame for doing this work.
For me personally, I thought that I didn't particularly care for the once a month. I would have liked to have seen it be the first 6 months once a week, and then the next 3 months, or no, actually the next 4 months every 2 weeks, and then the last 2 once a month. Because I thought we lost a little something when we went to for too long for the once a month.
Yeah.
Just
So
for
go
our
off the-
I was going to say, just for our participants' benefit, what Mike's referring to is the first 6 months are weekly,
Yes.
and then programs switch to once a month for the back end 6 months, right? So if you
Yeah.
haven't been, yeah,
We did 2 weeks for, I don't know, a couple of
A
months.
couple of months.
okay.
But I would
Switch
like to
to-
have seen that extended a little bit further, and then once a month be the last 2 meetings.
Okay.
And
Sorry,
Danielle,
Danielle.
you do something different, isn't that correct?
I do, because my participants felt the exact same way. They felt like going a whole month, especially when we were doing it virtually, was way too long. So we continue to do it every 2 weeks. Once we hit that 2-week mark, we never went to once a month. I just gave them the heads up that, once we got towards the end, for those 2 weeks, we'll be going over the same topic, but they didn't care about that. It just gave them extra time to talk, express what they were going through, connect. So I did find that, yeah, my participants, that's what they preferred. And I said, oh, okay, if that's what you guys want, we'll make that work. And they were happy with that. But I will say, because we were doing the halt, like instead of Angela, her classes are 1 hour, my virtual classes are only 30 minutes. So we would meet once a week, and then every 2 minutes for 30 minutes. And we usually would meet in the evenings because most of my participants had jobs.
And I would say that from some of the data that the data were mixed in terms of people's reactions to the year-long program. While some people did say that they wished it was shorter, and these are people who finished, others said that they selected the program because it was 12 months, because they really had typically learned from other non-successes that it takes time to change behavior. So they were grateful for the support over the extended period of time.
Yeah, I totally agree with that. Also, I think it being a year long is just critical, because it does take so long to make behavior changes and to make them stick. I have participants that they finished their year and they were like, well, when can I sign up again? So in the beginning, hearing that it's a year is kind of overwhelming for people, but once they dive in, I think they're grateful that it's a year.
And
Yeah, I agree with that. I've had participants who have gone through the program 3 or 4 times because they said, they just want to work on their goals, and they found that this program provided the most support for them. And having that year long, was a big important part of that. But I've had other participants who, as soon as they hear 12 months, I'm out, And it's definitely per person, and it's definitely where they are in that cycle of, willingness to change and make those behavior changes.
Danielle and Angela, I never thought to ask you before, but since you're mentioning that people re-enroll almost right away, have you experienced that with people who went through the partner program?
No.
Mm-mm.
Okay.
Actually, no.
No. No, I haven't had any re-enrollment, but I did have one of my partners who referred 4 other people to our next class that we were able to enroll.
Nice.
So,
maybe that's
2 were yeah, 2 were friends and 2 were family members. So I was like, thank you.
I think their goals are still doing well, so they don't need to re-enroll.
And I think too, the part of it is, and like I said, the one participant I had, she's literally gone through the class 4 or 5 times, I think, and she does not have the support outside of it. And that was her biggest issue. So I think with these partners, they're leaving the class with that support for the rest of their life. They don't have that, oh, well, okay, now I don't have a coach, I don't have these messages, I don't have these other people. I think that for a lot of people, makes them re-enroll because they don't have that support. But going through this program, you're continuing with your support buddy the whole time.
Makes a lot of sense.
Oh, go ahead. Sorry, go ahead. Mike, were you?
No, I was just saying it makes a lot of sense to me that, yeah, I think the biggest thing for me is when I get motivated on something like this, I usually stay with it for a long, long, long time. So to me, it was pretty easy, especially with my best friend and partner being with me, that it just made it very simple.
Well, I was just going to say, I don't know if we have any policymakers or other decision makers in our audience today, but I think reflecting on what you're hearing here is really important. And maybe Rebecca and Lisa, this is something we need to add in or start talking more about.
Great.
So while we applaud the person who's come back 4 or 5 times, right? Because obviously that's a level of commitment you like to see. On the other hand, that's not expanding the program. And it's also, your classes can only be so large. And so to how we open this by saying, if you're trying to have a big impact, on all the people, right? We're talking about millions of people, right? Who potentially are in this at-risk category. We've got to expand the number of people these programs touch. And we can't do that if people are can't leave the program because they don't have that support elsewhere. So there are actually resource implications, right? If the partner approach is better at getting people to a place where they can carry this forward and make room for more people to come into the program, that's actually a really much better use of all of our resources. And I don't think we talked about it from that perspective, but this conversation is kind of
that's exactly
think about that.
Yeah, so what we do in Charles County is anybody that graduates, they are offered the opportunity to join TOPS. So that gives them another meeting space where they can find support. So I haven't had many takers, but there's been a couple that have hopped over to TOPS and have found it successful.
Angela, can you explain what that is?
Sure. TOPS is a taking off the pounds sensibly. It's a evidence-based program that has been proven to reduce cholesterol and high blood pressure. And it's a weekly support group meeting.
Thank you.
That's run by the members.
Okay.
Ideally.
Okay. Great. We got a question about cost. So Rebecca, if you could address cost for our program, but then Danielle and Angela, if you could address cost in your normal everyday operations.
So we know that the answer is it depends. Some programs have grants or have funding that allow them to offer the program for free to participants, where other programs actually charge participants. YMCAs, for example, tend to charge between $250 and $300, but that typically also includes a family level membership to the YMCA. That sort of balances out the cost so that people also have a resource where they can be physically active. Many insurance companies do cover national DPP. And if you are on Medicare and you select your program carefully, then it is also covered by Medicare. Expanded Medicaid often typically includes national DPP coverage as well. So like I said, the answer is it depends, but you should be able to find programs that are accessible. And Danielle and Angela?
Yeah, so our program is free. We do have a little bit of supportive funding from some community organizations that help us with incentives and purchasing manuals and that kind of thing. I will say that if you put all of the costs together, the incentives, the manuals, staffing time, building expenses, it costs about $2,000 per participant to run the program. And that's just, an educated guess based on our numbers.
And currently at the health department, we don't bill for any of our NDPP programs. It's all funded either through the health department or through grants that we receive. So at the period of this time, we actually had received a grant from the Maryland Department of Health to provide our participants with $500 worth of lifestyle supports. So part of that is we put together like a welcome package, what included like a scale because we weren't meeting in person. It was completely virtual. So we provided them with a scale, a blood pressure cuff, a cookbook, some like stretchy bands for exercises, a Fitbit, and I'm trying to think. There was like a couple small other things like exercise stuff. So they got that welcome packet, which was I think around like $215. And then we allowed each participant then to decide what they wanted to do with the remaining funds, how they felt they needed it for whatever support, whether it was to join a gym, to buy new running shoes and workout outfits because they didn't have any, to really find out what they needed. But that was only a 2-year grant that we had that has now ended. So we try to work with our partners to at least provide our partners with a scale, a blood pressure cuff, and a cookbook at the beginning of all of our virtual classes. And again, that's just whatever funding we can find.
Thank you, guys.
Mike and Judy, do you have any observations about cost? Like, do you think that would have mattered to you? And what about your friends and family? Do you think having a cost associated with the program would discourage them?
Well, I'm really not sure. I mean, I guess a big perk is that it did come at no cost. And if there's any, that would certainly make it more attractive to people going forward, I would think, especially given inflation and all of the things that are happening right now. But it could be you can incorporate something else into the fee, like you mentioned the YMCA includes membership in the YMCA. We don't have any of those in our county, so but if you were to charge and the fee entitled the person to something else that was helpful, it might be an incentive.
All right, we have another question that came in, and this is for Angela and Danielle. Can you explain what a certified lifestyle coach is? And they're wondering if you all are dietitians as well.
No, so I'm a community health educator. I am a lifestyle coach. You get training to be a lifestyle coach through the CDC or an organization like DTAC. I'm also a master trainer select, so I teach other lifestyle coaches how to be a lifestyle coach. Those programs sometimes are offered free through the state of Maryland. Other times you have to pay for them. I'm going to use it just depends.
Yep. Yeah, and I started off as a community health educator, and now I am a program manager. But I actually got my degree from University of Maryland at their Community of Behavioral Health Sciences.
Yay, University of Maryland. Thanks, Danielle. All right, so Cynthia, I have one closing question I want to ask, but I want to open it up maybe to see if there's other questions from the audience before we do that.
Yeah, so any burning questions that we haven't addressed? So just, I don't know if everybody's noticed, but we've had about 80 people during our session the whole time. So I think that really speaks to the level of interest and kind of the novelty of what we're doing. So thank you all for coming and participating in this session. It's really great. We love that we're able to share the work, and you get to hear everybody's voice who's been part of this process.
Yeah, I think everything's we've covered has been perfect. I think,
Yeah.
Great.
All right, Lisa, you want to?
Yep. So I have a closing question. And we'll start with Mike and Judy. So now that you've gotten through the program, some time has passed. What about being in the program together has helped you sustain your healthy lifestyle choices? You've touched on this a little bit, Mike. You said, once you make up your mind, you just stick with it. But what has helped you to maintain that healthy lifestyle since you've come out of the program?
Just for me, just thinking about when I look at, because we've had a lot of heavy people in our family, and just thinking about the way they have done, actually done something to almost like they've done something to themselves because they won't change. They won't change their attitude. I had one brother-in-law who passed away a couple of years ago because he would not change. And he was very heavy, and he ended up basically, I tell people it was suicide by choice, because he just would not change. And I have another brother-in-law who's almost the same. So we'll see. I don't know how much longer he's going to be around, but we'll see. Just when I see that, and I said, "Oh no, I'm not doing that. I'm trying to stay around as long as I possibly can." Doesn't mean I can't get hit by a car.
Right. But you're making those healthy choices. That's great.
Yes.
Thanks, Mike. Judy, did you want to add anything to that?
Well, I think that, you sort of, when you can move better, you feel better. And and making healthier food choices feeds into all of that. So I think overall it's a reward in and of itself if you can make the changes that allow it to be.
Yeah. And I personally, we have a senior center that's just not even 3 miles from here, and I usually go there 4 times a week and do different exercises. So taking care of myself that way also.
The classes have reopened, after COVID and all of that.
Right.
Do you think, Mike, you would have done that without the program? Would you have just gone to the senior center 4 times a week just because?
Yes. Well, I used to go 2 times, and now they have another instructor who I like also. So so now 4 times a week.
Okay.
And then I usually walk on Monday, which is about 1.5 miles in the park.
That's excellent. Excellent. Thank you both so much. And Angela and Danielle, our question for you is, you've shared some of this already, but now that you've completed the program, what's your reaction to the partner approach? What do you want to tell the audience that's with us today?
I felt like it was just overwhelmingly successful. I had the best attendance of any class I've ever taught since 2016. I had the best retention rates and the best weight loss, and also an increase in physical activity minutes, which I haven't seen in other classes. So yeah, I think it's just overwhelmingly successful, and I would absolutely will do it again.
I can echo that. All of our measures were well beyond all of our other classes that were individuals. And I think I might have been one of those coaches who said, if I could just teach this class, I think I would just teach this class, because as a coach, I felt like it was more fulfilling, because you could really see the changes and the progress and everything that these participants were doing. And I really felt like they gave it their all. And I can't say good enough things about this program and everything that FHI 360 did, and Cynthia and your team with the materials that you guys provided us as coaches. Like, I didn't feel like I was unprepared in any way. I felt like I was going in with this class knowing how to teach it as a pairs class, and knowing that I had the materials that if I needed to reference back to something, it was all right there for me.
I agree.
Thank you both. And just to let you all know, there is a message in the chat that somebody said they really appreciate hearing the perspectives of Judy and Mike and of the coaches. So thank you guys so much for all of that. So Cynthia and Rebecca, any other questions?
Well, I guess, when you have an idea for a program, right, and then you get the funding to do it, and you always want it to be, you hope that it's going to be successful, but like as you're going through and, you're just kind of like, you're hearing about the interviews and the focus groups and whatever. But it was when I read the final evaluation report and heard what Mike and Judy and the other participants said, what Angela and Danielle and the other coaches said, and it kind of all came together. Even this session today, you're kind of like, wow, maybe this is really something that could have a really positive impact, right? Because at the end of the day, that's why you work in public health, right? You want to like make things better. You want to make things better for people. You want to make things better for communities, and to find something where people feel so good about, and it seems to it's not just the feeling, but it's the results that you guys are talking about. Because that's what the funders care about, is they want to see the weight loss, they want to see the physical activity minutes, they want to see all of that, right? So I think it's just really exciting to hear that it was a really good experience for you all too, because you like to know that your ideas work from time to time. So thank you all.
Thank you, Mike and Judy. I really appreciate you taking the time. And
thank you.
You, of course, were model participants, but I know you worked really hard to meet your goals too.
Yeah, thank you so much.
Thanks, it was fun.
Thank you.
Rebecca, any final thoughts from you?
I just want to echo my thanks. It's been wonderful to work with Angela and Danielle. And when we reached out to participants, we got very, very high responses and had fantastic discussions about the program itself. So we're very grateful at the implementation ease, and glad that it seems to be successful.
Yeah, thank you so much to everyone, all the participants.
Yep, and I'm just going to echo exactly what everyone just said. So thank you guys so much. This was so enlightening and interactive and fun. So thank you.
And thanks to the 72 people or however many who have been on this, as Cynthia said. We're really appreciative.
One final question came in. We did not measure, we did not give any health literacy or literacy assessments. But if you've been attending this conference, if follow health literacy work, that's true in any group of people. There will be different levels of health literacy, but no, we did not measure them officially. So, all right. Well, I think we've answered everything. And any final words from anyone before we wrap up?
Nope.
We're good.
Thank you. Thank you for your time and for sharing your experiences.
And thank you.
You're welcome. Thank you.
Thanks.
Bye-bye.
Bye, everyone.